This video will discuss everything you need to know about aminoglycosides. So first of all, what do aminoglycosides and things that end in syn, for instance, like you have gentamicin, neomycin, all the streptomycins, all the syn, and then you have the clines, right? So all your clines like tetracycline, doxycycline, monocycline, just all of your cyclines, right? And your syns. What do these guys have in common? Well, they're both going to inhibit or block the 30S subunit. So that's our first little factoid that we need to know. Now, also, we can know that there's hypersensitivity reactions like autoimmune hemolytic anemia, disulfiram-like reactions and stuff. There are some adverse effects of your cephalosporins, and one of them is that it will increase the nephrotoxicity of your aminoglycosides. So nephrotoxicity is something that you should keep into account. Your aminoglycosides can also have a synergistic reaction with aztreonam. And the aztreonam is used for your gram-negative rods only. There's no activity against your gram-positives. And so you can have synergistic effects with your aminoglycosides. That's the third thing to know. And for penicillin allergic patients, you can also use this in those who have a renal insufficiency, because those with renal insufficiency can't tolerate aminoglycosides. Why? Because they are nephrotoxic. Okay, we're painting the picture together. And so when you're talking about protein synthesis inhibitors, they specifically target the smaller ribosomal or bacterial ribosome, like the 70S that's made of your 30S and your 50S subunits, and that leaves the ribosome 80S unaffected. And so all of these protein synthesis inhibitors are going to be bacteriostatic, except your aminoglycosides. These are bactericidal. And so we talked about how our tetracyclines, your clines that we talked about earlier, and your syns, those guys are all your 30S inhibitors. And a way you can remember this is you have like your aminoglycosides and your tetracyclines. Then remember your cleans, your clines, and your A's is you buy at 30, and then you're going to want to sell at 50. And what does cell stand for? Chloramphenicol, clindamycin. E stands for erythromycin. These are like your macrolides. And L stands for linezolid. So buy at 30, sell at 50. So your aminoglycosides are going to be gentamicin, neomycin, streptomycin. You think they're aminoglycosides. You think gnats cannot kill anaerobes. All right, so gnats, N-A-T-S, so G-N-A-T-S, so gentamicin, neomycin, micocin, tobramycin, streptomycin cannot kill anaerobes. All right, so there's some antimicrobials they need to avoid in pregnancy, and aminoglycoside is one of them. Why do you need to avoid the aminoglycoside? Because it can be ototoxic. So nephrotoxic and also ototoxicity is definitely worth looking out for. There are also some drug reactions, renal and genitourinary, that you need to look out for. The nephrotoxic, of course, being cisplatin, and your aminoglycosides and amphocyterin and vancomycin. So keep those in mind. Also, they're involved in parathyroid hormone regulation. So the common causes of decreased magnesium, so that's the 2+ would be your diarrhea, aminoglycosides, diuretics, and alcohol use disorder. You can also remember, the mean gnats will not kill anaerobes. You can also remember that a mean guy hit the baby in the ear. So think of an ear and somebody being mean and hitting that ear. And that could help you with the ototoxicity. And that's all there is to know about your aminoglycosides. If you found this helpful, then please like and subscribe. We'll see you in the next video.